Hello everyone, welcome once again to BHIS TV. I remain your host, Wengiswaton Agada. Now today on the show, we will be discussing a very important subject, which in Nigeria is considered a menace, and not just in Nigeria, globally, even within the African region. Now we're talking about malaria. Now with me in the studio, I have a doctor who is a specialist in public health. Please join us. Welcome, Dr. Emakito. Dr. Emakito, good to have you with us.
Thank you. Good to have you so
much. Thank you so much for coming. Globally, malaria is considered one of the deadliest diseases, and in Nigeria, we find that it's so prevalent. In Nigeria, especially within the southern region, right, like Bayelsa State, for instance. I saw statistics online that says Bayelsa State is one of the states, that has the one of the highest rates of malaria breakouts, in Nigeria. And we were talking about that briefly. But before we delve into that, I would like you to just introduce yourself.
All right, thank you so much for having me.
Yeah.
My name is Dr. Malachi. I'm the program manager for the State Malaria Elimination Program Bayelsa State.
Yeah.
Just to ride on your intro, malaria is, of course, malaria predates every one of us.
True.
And it has been a menace, like you put it, not just in Nigeria, but in Africa and also the world at large. Yeah. Even though we know that much of the burden is domiciled here in Africa and Nigeria, we account for about 25% of the burden of malaria in Nigeria. Yeah. So, but the good thing about malaria is that it is treatable.
Okay.
It is curable. So people shouldn't die from malaria.
Yeah.
Okay. And we know that malaria causes morbidity and mortality a lot. About close to 95% of the morbidity and mortality of malaria is in under fives and also the pregnant women. So I would say that it is a very good opportunity for me to be here because we are having our World Malaria, which is a day set aside to commemorate and celebrate World Malaria, and also to talk about the challenges we are having, also the progresses we've made in trying to curb this disease, and what we need to do going ahead to make sure that we eliminate malaria in Bayelsa State and also in Nigeria. And the theme for this World Malaria Day is Malaria Ends With Us. Okay. Reinvest, Reimagine, and Reignite.
All right, now still moving further, with the work you do at the State Malaria Elimination Program team, what would you consider to be the prevalent statistics in Bayelsa State?
Okay, if I talk about Bayelsa, we'll talk about Nigeria. We are about 22% prevalence in Nigeria, but Bayelsa State, we are 17%. So I just wanted to make a correction about what you said you saw online.
Yeah.
We need to come down to even a single digit. There was a survey that was done, a malaria indicator survey that was done, and it showed that about 673,000 estimated cases of malaria in the state. 70% of these cases are in under fives and pregnant women. Yeah. From our DHIS data, DHIS is, it will mean District Health Information System. So we accounted for, in Yenegua, that's from 2024 to March of 2025, we accounted for about 808 deaths.
Wow.
In Yenegua LGA. Okay. For Southern Nigeria, we had 54. Now for Ekremo, we had 41. Ogbia, we have 20, Brass 18, Sagbama 14, Nembe 12, and Kolga 2. Then for Bayelsa as a whole, we have from 2024 till date. What our data gives us is 969 deaths from malaria. So, but in terms of the prevalence and in terms of the confirmed cases, Yenegua is the highest, which is understandable because it's the capital. We have more population here at about 39,087 cases, followed by Sagbama. And this is from 2024 till this time. Okay. And then for Sagbama, we have 10,938, followed by Southern Nigeria, which is 9,912. I think the list currently is Kolga, which is 5,451 cases. Yeah. So just to talk about stats and data, this is what we have currently in the state.
All right. Now, with these rates, what are the strategies that have been put in place, to combat the prevalence of malaria within the Bayelsa State?
Yeah, the states have been doing a lot. So there are different interventions in the malaria program. We have the long-lasting insecticidal nets, which we all know as the mosquito nets, which we use to prevent ourselves from getting bit by the female Anopheles mosquito. Of course, we know that malaria is caused by a parasite called Plasmodium, but it's transmitted by the bites of an infected female Anopheles mosquito.
Yes.
So if we try to curb or eliminate the vector, which is a mosquito, we'll go a long way in eradicating malaria. So the nets are very important. That is one way we can, eliminate malaria. In the state also we have the IPTP, which is the intermittent preventive treatment in pregnancy.
Okay.
Like I said before now, one of the groups of population that are really affected by this disease is the pregnant women, because at that stage they have reduced immunity. That with also the under 5s. Okay. So there's a special package for them, a prevention mechanism for them. Okay. So we've heard of SP, sulfur-dosing pyrimethamine, which we give to our pregnant women for prevention of malaria. We also preach on environmental sanitation. Okay. Because we know that the vector mosquito breeds virtually everywhere. Before now it was in stagnant waters, but now even plantain leaves, even your sachet water you drink and throw away, it can breed there. Sure. So we need to clean our environment, clear our bushes, and make sure that we take hygiene very, very serious. Right. Then also to prompt diagnosis and early treatment. So it's important that not all fever cases are malaria cases. So most persons think that whenever they have fever, they have malaria, but there are so many other illnesses that can cause malaria. So as a program, we advocate for test and treat. You must test before you treat. So we should visit the health facility, get tested, and if it is positive for malaria, we treat accordingly. So as a state, we've been able to distribute anti-malaria commodities to about 265 facilities in the state. From October last year till now. The anti-malaria comprises of both tablets and injections too. We've given IV artesunate for treatment of severe malaria too. And also there are newer molecules of the anti-malaria which we got, and we've distributed that to most of our facilities too. So I think we're also carrying on sensitization and awareness. Okay, and that's even the essence of the World Malaria Day, to create awareness, which we are doing. We are going out to conduct outreaches in different areas in the state, because there are so many myths and misconceptions about malaria. Also, there's also this poor health-seeking behavior. So if we go out there, pass the right message in terms of advocacy, communication, social mobilization,
people will be aware. They will know the right thing to do.
I know the right things to do.
Still on these preventive measures, earlier you mentioned the distribution of long-lasting insecticide-treated nets. How do you carry out the distribution? Do you go house to house? Do you go maybe to special places like public fairs, like the market, the schools, to carry out these distributions, or how do you do? Tell us about it. Okay, so
so there are two different ways. Like for the mass campaign, we do house to house distribution.
So you go to particular community, for instance, and do house to house.
Yeah. Within distribution, I mean healthcare workers. We go to facilities. And during immunizations, during antenatal clinics, we go and give to the pregnant women, and also during immunization, we give to mothers and their babies. And so these are the two different areas through which we can distribute the commodities.
Last year, I think precisely, that was November also, there was a national report that Bayelsa State and Kebbi State received anti-malaria vaccines.
Malaria vaccines.
Yes. So can you tell us about that? Like, did you actually receive it?
Yes. So I would say we are privileged and fortunate that we were one of the two beneficiaries of that intervention, which is the malaria vaccine. We rolled out at the 2nd December last year. The vaccine was rolled out. And as mothers are taking their babies to be vaccinated or to go for immunization, yes, they will also be given malaria vaccines.
Right. So how would you describe the success rates of the anti-malaria vaccines?
Okay, so we started, like I said, we started December.
Yes.
So we are still not too...
so that's like 5 months now?
Yes, but we are not too happy with the uptake though. Okay. I think the first dose uptake was good. All right. But the malaria vaccine is given at 4 doses, the first dose, second, third, and the booster dose. Okay. So the first dose was really, really encouraging, but from the second dose, we'll not be really getting the desired uptake we need, and we are doing all we can to making sure that we close those gaps and get our children vaccinated.
All right. Now,
some persons believe that you can get malaria from just standing under the sun. Okay, and some persons believe that it is a spiritual
attack.
So most times, even when they are sick, they don't go to the health facility or health center, because maybe to access healthcare. Some just believe that malaria is something that I have known all along. It's something that I can treat. Is it not just to just go to the chemist and mix medicine?
That's what they call it, mixing.
Let me just mix it. So they will mix medicine for 100 naira for you, for malaria. For a malaria drug that is currently around 2,500 to 3,000. Every 2 minutes, a child dies from malaria. So it is really, really something we need to nip in the bud.
Yeah, sure.
It has been with us ever since, and I think some countries have eliminated malaria. We can eliminate it too. So it's just for us to create more awareness and demand generation, create awareness, sensitize people on the needs for them to access healthcare whenever they have the symptoms of malaria, so that they can be treated on time, so it doesn't progress to severe malaria. Because we have two types of malaria: the uncomplicated and the severe. We're talking about also dissemination, sensitization and awareness. You need Ministry of Information.
Sure.
Look at what I'm doing here. This is also a way of, sending out the message and sensitizing, and this is information going on. So we need everybody. We need our traditional rulers, to give us that access to communities and their buying. In terms of our malaria programs and interventions, we need the people, the community people. We need them to even accept what we are bringing to them in the first place. So every person needs to be on deck. I think collaboration is key, and with collaboration, we can do a lot. We can achieve a lot.
Sure.
And that is what we've been doing in the States.
All right. So now, please, can you tell us some of the success stories you have experienced, working with the SMEP, that's the State Malaria Elimination Program?
Okay.
So just give us some success stories.
All right. So we are also too, by technology, we are happy that we have the zip line with us here in the States, which uses the technology of drone to send in commodities and also our malaria vaccines
to some rural villages.
Because we have issues with accessibility in most of our communities. So I think with that, we have a success story. The zipline drone system or technology have really helped to push out some of these commodities like the vaccines to the hinterlands. We've been able to reduce our burden from where we were before to 17% currently, and we are not resting on that. That is still high for us, and we are looking at, like I said earlier on, having a single digit and permanently eliminating malaria from Bayelsa State. Other interventions in the malaria program, what we call IRS, indoor residual spraying.
Okay.
So this is an intervention where you spray insecticides, that's the chemicals, to kill the mosquito, but you don't spray it outside the house.
Okay, stuff like there's this local name, Otapia.
But not like this one is like this is like you're spraying it on the walls.
Okay.
You're spraying it on the walls of the building. Okay. And it lasts for up to even 8 months.
Wow.
Because the mosquito vector perches on walls before it comes to bite you. And so that's one plan that we are looking at. We've not started that in the States, but it's something we are thinking very seriously. It's capital intensive too.
Yeah, sure.
That's one intervention we are looking at. We also have the larvicidal spraying too that we are thinking about. That's to do with spraying water bodies with chemicals to kill the different stages of the mosquito. It starts from the egg, the larva, the pupa, and all that. So these are interventions that we are planning to embark on.
Can you speak to Bayelsans, advising them on basic steps they could take in order to prevent malaria?
All right, so my people from Bayelsa State, it's very simple. Malaria not be spiritual problem. And not be say when you stay for somewhere well, you will get malaria. You understand? The malaria is something, a parasite and they cause malaria, but that parasite no go fit fly, enter our body, enter our blood. You go pass through mosquito, and not be all types of mosquito, the female anopheles mosquito. Make we take care of ourselves. Malaria is curable, it is preventable, it is treatable. How one can prevent malaria? What are the steps we need to take? We need to make sure we clean our environment very well. And also, whenever we notice our pikin body or even ourselves with the hot or with the vomit or headache day, make we no rush go chemist, go mix medicine because we don't know what be the situation. Okay? That money we will carry ways go. We will just carry and go to the nearest health center or health facility wey dey near us. Malaria treatment na free for the state. So once we test say na malaria, we go give drug to treat the malaria. So make we no prolong stay for house, say, don't worry, I go give bitter leaf, I go mix bitter leaf and ugu, or I go carry am go prayer house. Make we sleep under insecticide treated nets to prevent mosquito from biting us. So those wey get nets, try dey use your net, but those wey no get, make sure say you no dey too open your house make mosquito no enter, because mosquito go come in for night, come perch, dey wait for you when you sleep, he go attack you, bite you. So make sure say we close our houses early. All this we go
combat
we go
malaria.
reduce the burden of malaria in the state.